Hey guys, we have a great show today because we're going to take a peek back in my past to go through my personal journey to break into the industry. For some of you guys that haven't been to this show, my name's Joe Licata. I'm the owner and founder of RepPath. This is our weekly RepPath call for really geared towards individuals either looking to break in or advance in their careers. And we've changed up the schedule where we're doing 2 shows a week now. Mondays are more for advancing in your career, more advanced topics, and Wednesdays are more of that entry level where we're trying to address, the individuals that are looking to try to break into the industry and really, find their path in the medical sales career. For all you guys joining today, please make sure that any questions, any thoughts, comments, please share in the send them, from this moment on, and our podcast producer James will take care of that. We'll address all of these about halfway through the show, where we're able to do a little Q&A. So any thoughts, questions, please submit them now. For any of you that want to see a copy in case you missed this, or you want to go back and review this episode, please make sure you subscribe to my YouTube channel. That's where all our content is. That's Unfiltered Medical Sales Coaching. So make sure you subscribe to that. We're going to be live today, as always, on LinkedIn, YouTube, Instagram, Facebook, etc. And we're live. Also, we're on every podcast platform from Spotify, Apple, YouTube, and iHeartRadio, amongst many others more. So again, thank you guys for joining. I'm excited because get to talk about how I got into this industry. And the topic of the show is, getting into medical sales. How do you break in without sales experience? So a lot of you guys out there don't have sales experience and think, well, I can't get into medical sales, because to do that, you need sales experience, or you need even more, you need medical sales experience, or you need a family member that's a doctor or that's in the industry that has maybe a VP position, either in a pharma or a medical device company. And it's not true, guys. You don't need any of that. And I'm going to share a big secret with you. No one is born with experience. I mean, that's obvious, but you have to realize that. So I know the feeling that you have, because I was there myself over 23, it's almost 24 years ago now, where I was trying to break in and I felt like, well, pharmaceutical, medical device sales, whatever it was, that's more advanced. I can't get into this industry, because I don't have any experience. So when I was in college, I wanted to be a doctor. So during my college years, I volunteered at St. James Hospital in Newark. And this is something that any of you can go out there and do today. So I didn't have a family member that was a doctor. We didn't have aunts or uncles or anyone else really that had any medical expertise, and didn't really have many family members that had big sales jobs out there. So I was the first in my family that wanted to get into this industry. So you have to do that. You have to make the relationships, build the contacts, and do it from scratch. So whenever I hear that excuse from anyone, I don't have experience, you got to change your mindset. And that's the key. The mindset is key, is that yes, you will break in. It's just how much work and time are you willing to put into it? But you can't think to yourself, this is too advanced for me. This is out of my league. I don't have experience, so I'm not even going to try. Or all these other people have such an advantage over me. They don't. They all started in the same place without experience. So to tell you a little bit about my journey, again, when I was going into high school, going into college, I always wanted to become a doctor. And I volunteered at St. James Hospital in Newark, which is no longer there. But I got experience by shadowing this Dr. Anthony Ferrara, who was an oral surgeon. And what was great about Dr. Ferrara, I just went up to Dr. Ferrara and asked him, can I shadow you? I want to become a doctor myself. I want to observe cases. What can I do to get more experience? And I know the times have changed where you're not allowed to just shadow doctors in the OR anymore, but you can definitely do this by just approaching doctors that you know. You guys will be shocked, how far you can get just by asking. You might get turned down a lot. So what? But I just ask, can I shadow you? Can I observe cases? And he said yes. So he allowed me in to a couple of his cases one day. And then while I was there at in the OR, I started to meet the rest of the staff. During breaks in between cases, I sat in the lounge, start speaking with other doctors. Before you know it, they're like, Joe, why don't you see this case? I had one time I saw a 94-year-old lady get her leg amputated, which was a crazy case to see when you're only 19, 20 years old. But it was awesome. So now I start to build all these other relationships. I became friends with Dr. Colavito, who was the chief of surgery at the time there. So I literally was going from OR to OR, observing cases all day long. And for someone that wants to go to medical school, I mean, this was amazing because you're seeing things that only, pre-med students, medical students see. You're not even going to see this in college. And that was even advanced, even for a lot of, it was probably like a third year that you will probably start seeing those cases. The first 2 years you're doing, more coursework. So I was seeing stuff that most people didn't see that were probably 3-4 years ahead of me. Awesome. All awesome stuff. But what I really learned was I started to see what the sales reps did. And I never really knew. I heard of pharma reps, I heard of device reps, but I really had no idea what they did. And I remember being in cases, seeing these young 24, 25-year-old guys coming in there, and they're telling the doctor who's 60 years old with gray hair what to do during these cases. And that blew my mind. I was shocked. I saw one ortho case where I didn't know who the doctor was. I really did not know. The only reason why I knew, because I assumed the older guy in the room was probably the doctor. And I thought that was a younger doctor that was telling him what to do. So I was shocked that a younger guy was leading the case, but I thought the younger guy was the doctor. So, and it blew my mind after the case when I introduced myself and he handed me a card that he worked for one of the device companies. And I was shocked. It was an amazing moment because I'm like, wow, this is out there. Like, this is what a salesman does. To me, a salesman is the annoying guy that knocks on the door and tries to get you to buy whatever bullshit they're selling. And this was not what I thought. I never thought that they would have that much respect in the operating room. Obviously this was a great rep that, wasn't his first rodeo, where he's been working with this doctor a while. So they did look at him as a true asset. And as I learned as time went on, that takes time too. But it really got me interested on the sales side. So I never thought about sales. Sales to me was something that, just wasn't in my character. I didn't think I could do sales. Didn't think it was for me. I was just focused on being a physician. And that actually got me to change gears and want to go the sales route, because that was exactly, what would fulfill all my needs, where I could still get the respect and also the excitement that I have for healthcare, to be in the operating room, to help patients out. But now you also can, you don't have all the responsibilities, which comes with a lot of headaches that these doctors deal with, in terms of legalities, insurances, reimbursements, a lot of things at the time where doctors were talking me out of becoming a physician because of the different challenges they were having. And so that pushed me into, focusing on sales. So fast forward now 2 years of doing that. And now I graduate. At the time I went to Villanova. Villanova wasn't as good as it is today, so it sounds better, but I was definitely one of the last dumb kids to graduate from Villanova. But at the time, when I got out of school, now I want to get into medical sales. I'm fired up. So I start getting my resume sent out. I was sending my resume to anyone and everyone. And didn't matter who it was, what company, what opening. I went at the time, they used to have these, it was like a cattle call type of job interviews, where it would be at like the Hilton or the Marriott, where hundreds of reps would show up, multiple companies would be there. And then you would literally wait online to interview whatever companies you were interested in. And so all the pharma device companies had like maybe 100 people waiting online just to sit there and introduce yourself with the hiring manager. It was crazy. But I did all this and I was getting nowhere, literally nowhere. I was shocked. I got a biology degree from Villanova. At the time I was geared to go to medical school. I actually got into a medical school in St. George's in Grenada, and wind up pivoting and not going through with that and wind up going the sales route, like I said. So I thought I had all the credentials in the world, where this was a step back. I wanted to be a doctor. Now I'm going to be a salesman, and no one even get back to me. It blew my mind. So, and it frustrated me. So getting ghosted over and over, I didn't even get rejections. I got ghosted, hundreds of resumes sent out, tons of those types of interviews, those cattle call interviews, trade shows, all those things I went to, and I got nothing out of it. So I realized I got to change. I got to do something different. And I had a few friends in the industry that took B2B sales roles, and one of them worked for this company called Carico. And Carico was a company that sold home health products. They sold air purifiers, water filters. And they told me, they're like, if you really want to get into medical sales, get B2B sales experience. Now, some of you out there, because I get it too. I'm like, I don't want to do that. I don't want to sell stupid products that people use in their house. I don't want to, sell Cutco and be like an Avon lady going knocking on doors. But my friends that went through this, they're like, number one, you don't know if your sales are for you. You think it's for you, because just like a lot of you today, I'm sure you hear from a friend, from an aunt, an uncle, someone that's in the industry, your neighbor. They tell you how it's great. They're making good money. They get a company car. Some days when they're done at 12 o'clock, they can go play golf or meet with their friends for lunch. They don't have to be behind a desk all day. All those things are great. But until you know what it's like to get doors slammed on your face, to not see people call after call, to get ghosted, to get rejected, to have people look at you like, what is this garbage you're selling? You don't really know what sales is, and if sales is for you, until you do that. So that's why I always strongly suggest, guys, you have a long career. You could be doing this the next 60 years of your life, literally. Don't rush just because you want to get into medical sales and have these B2B sales opportunities like an ADP, Paychex, Cintas, UniFirst. Don't rush it, because getting that experience a lot of times is so good that candidates don't leave. They stay at those jobs for a career. And there's a reason why. It's because they're paid really well. So you could still have a great career if you get into B2B sales and not want to get into medical sales later on, which is okay. But to get that experience, that's how you really know if sales are for you. So I highly suggest, if you're struggling and you can't break in, don't just give up and say, I can't get into medical, so I'm done. That's not the right mentality. The mentality that the rep that does become a successful medical sales rep, they don't care what they have to do. They will do whatever it takes. So getting back to the mindset, like I said earlier, definitely don't be intimidated by not having the experience, but also have that attitude that I will do whatever it takes to get into this industry. I will sacrifice whatever it takes. That's what the reps that break in, that's the mentality they have. If you're calling up and you're saying to a recruiter, or whoever is trying to help you get a job, well, Joe, I'd like to break in, but I don't want to be in the OR, and I don't know if I like pharma that much either. I definitely don't want to be in ortho, and you have all these limitations. Guys, this is not for you. Straight up. I mean, the more that you get experience in your career, then you could be picky, but definitely not at the beginning. So don't have that. I won't do this. I won't do that. Be open and be willing to do anything to break in. So back to where I was, I had the job at Carico. First couple of months there, I was a disaster. I couldn't sell anything. Nobody was booking an appointment. Then when I got appointments, people looked at me at the end of the call and said, what the hell is this? I don't want any of this crap. I was awful. I was actually a very bad sales rep. I didn't know what I was doing. So, but over time, you get better and better. and you build that confidence. And that's the key, guys. The more you do this, the more confident you're going to get. You're going to be in your first operating room. And again, you're going to be a disaster. You're not going to know what to do. You're going to freeze up. They actually say that you lose, 10 IQ points in the first case that you're in when you're by yourself. And it's true. You actually get a little dumber. I know it sounds crazy, but you're so nervous and you don't want to screw up that you end up, hopefully it's not a major screw up, but you forget things. You start overthinking. You're just very nervous. But when you get that sales experience and as time goes on, you get better and better and better. And before you know it, you're so comfortable that now the sales start coming in because you're not nervous anymore. You're not thinking. You're just doing, and that's the place where you need to be in any sales role where you get very confident, and that shows in your presentation because you know much more about the product. You know about the features and benefits. You're ready for those objections because you heard them now 50 times. So you're not just, clamming up, deer in the headlights, like, I don't know what to say next. This person doesn't want my product. You're ready for it. So it's getting those jobs too helps you become a better salesman overall. So whether you're in B2B or medical, focus on being the best at what you do, being number one. Because getting a B2B sales job, even as if you're using it even for a bridge to get into medical sales, that's not enough. Guys, you still have to perform. So some of you think like, because I get these calls all the time, Joe, how long do I need to do this B2B sales role? Do I need to do it 6 months? I've been here like 9 months. Is that good enough? And that's the wrong attitude, guys. I want to see, so what are you ranked? What is your growth? Are you hitting quota? Did you get any awards? These are the things that you have to be putting on your resume from day one. Once you start getting that, that's all you should be worried about, is that no matter what job I get, I'm going to be the best at. That's the way a high performer thinks. That's the way these top medical sales reps, that's how they become the best, because it doesn't matter where they are. They're going to be the best at it because they're obsessed with the competition. They're obsessed with competing. That's why they like college athletes, guys. That's why they like military, ex-military, because they like people that are disciplined and are going to achieve their goals. And a lot of those candidates with those backgrounds have those skills. So focus on being the best no matter where you're at and really honing your sales skills, because just putting in time, looking at your watch, saying, how many more months do I have to do this crap before I get into medical? It's not going to get any easier. Companies still aren't going to get back to you just because you have a little experience. If you didn't perform there, then why should they want you? So take that as advice that the main point of that is you don't have to rush. So getting one of those jobs first is great. I hope everyone breaks in right out of college and gets their first medical sales role the day they graduate. I really do. But the reality is some of these companies want to see that experience first. And don't take it as you're losing out. You're falling behind. You're not. You don't know if you can sell yet. Get good at selling, and the jobs and opportunities will come. I promise you that. The better you get at selling, the more opportunities you have. So getting back to my story, remember, I came out of school, nobody would talk to me. No one. I literally can't even tell you the rejections because no one was answering me. And I sent my resume out to everyone. Now with a year and a half in and sales success that I had on my resume, I had my awards, I had my high rankings. I went from being a garbage salesman to actually, being one of the top reps in the company. So now I went back and started applying, and it wasn't the same exact opening, but same companies, many of them now are getting back to me. Now I'm getting interviews booked. Now I actually have the experiences, because a lot of these interviews, guys, they're going to ask you, tell me about a time. So when they talk about the STAR method, most of you probably know what that is, but for some of you that don't, the STAR is situation, task, action, result. That's the way they want to see how you answer these questions. And they formulate that. The way they ask that is, tell me about a time you experienced this. Tell me about a time you had to overcome a difficult customer. And then you walk through that But the only way to really answer these really well is by having the experiences. And that's what you get from your B2B sales role. That's going to give you that. You're going to be so confident in these interviews because you experience a lot of the things that they ask you. I mean, they ask a lot of the same questions for a reason, because they want to see if you really learned anything. You have these experiences. Let's be real. Some people can make up stuff on their resume. To me, I didn't even care if you make something up on your resume. It doesn't really matter to me. But if I get in front of you, now I'm asking you questions, and you can't answer them correctly. Now we have a problem. Now I don't even care if you did say you were 3-time President's Club winner. If you can't walk through your strategy, your process, your daily activities in the interview and really prove to me that, wow, that's a great plan, or I really, appreciate your approach, and I think I would use that too because I could find success, then it doesn't matter, guys. So you need to get those experiences because they're only going to make you better. So from there, was able to answer all those situational questions, did really well, got a couple interviews with companies, but still couldn't land the role. And the next part I want to talk about is the sacrifice. So for all you out there that say, I would love to do this, but you always have an excuse. But my current job right now, I work late. I take care of my kids. I don't have any time, Joe. I can't speak to anyone. I can't get in front of anyone. It's very difficult for me. My simple advice to you is, good for you. Don't do this. Don't even waste my time. Don't even waste the company's time. If you really want it, you don't have excuses. You will make it happen. So for me, I had an interview with Oregon Pharmaceuticals. And to get this interview, it was scheduled on a Thursday. I believe it was like a Thursday in early November. Reason why I know that, because I was supposed to go to Aruba with my family. And the only time they could do that was that Thursday. We were leaving 2 days before. I didn't even hesitate. I told my parents, sorry guys, I can't go. Now the rest of the family and my cousins, it was a big family trip. They were like, they get it. They were disappointed, but they were like, no, you got to get this job. This is what you really want. Vacations will be there. And so I didn't go on the trip. My whole family went. I had the interview. Now, all the more in my mind, this is where my mindset, where I was like, I am getting this job. I was like, I'm not giving up a trip. And then also, I'm not going to do everything in my power. I'm going to do everything to get this job. So I canceled the trip, go to the interview. But before I went to the interview, I reached out to every rep that was in my district. I reached out to everyone. Most of them didn't get back to me. I actually had 4 people got back to me out of 11. And really 2 of them gave me information. 2 of them were just nice, but they kind of rushed me on and off the phone, said best of luck. But 2 of them gave me a ton of information about the role, but more importantly, about the manager. And I knew so much about my manager at the time. And my manager, Mel, I don't want to give his last name just in case, but one of the greatest managers that, it was a big role model for me to, number one, allow me into the industry. But also, I just learned a ton from him. But before I met with him, I knew everything about him. I knew his management style. I knew about personal things. I even knew his favorite diner that he liked to go to, which I still remember is the TikTok diner on Route 3. So when I had all this prepared, and he asked me in the interview, what did you do to prepare? And I walked through everything. I had my notes. I had the names of all the people I spoke to. I talked about everything that I've learned about his likes, dislikes, all his drivers. What does he like for reps to do, not like to do? I mean, I put in a ton of effort, guys. He was so blown away. Like, he started blushing in the interview, smiling like, holy shit, I can't believe you found all this stuff out. Like, how long did you speak to these people for? And it really didn't take that long. It just took persistence and getting the right person to give me a lot of the info. But I took it a step further, because when I went for the final interview, I met with his boss, Jeff, and I did the same thing. I found out everything that I could possibly know about Jeff too. And I let him know in that final interview. And this definitely made me stand out. But one of the key drivers that got me the job was Mel wind up finding out through the HR personnel. He goes, wait, I heard that you gave up a trip with your family for this interview. And I didn't say it. I didn't tell him that in the interview. I was very humble. But when he brought it up, I said, actually, I did. And he's like, okay. He goes, I'm very impressed by that. Now I was lucky enough that the HR rep actually told Mel, like, hey, I just want you to know how committed this guy is. He gave up gave up a vacation for his family to be here. That really got me over the top. So it comes back to sacrifice, guys. And I did whatever it took between the sacrifice, between the research, and really wanting it and saying, I'm going to get this, changing my mindset. I wasn't intimidated anymore. I knew I was ready. I knew I deserved to have this job. So you got to think, guys, that I'm not lucky to get this. You have to have that attitude that they're lucky to have me. And it's not being arrogant. It's when you put in that much work and that much prep and learning everything possible about the role, and about that manager, you should feel confident because you're going to take those same skills and do that with physicians. And they know that. So when they see that you put that effort in, they go, holy shit, if he's doing that for an interview, what is he going to do to make money? What is he going to do to sell? This guy will, put in all the hard work and research to learn about his customers too. And that's going to make you deadly out there. Because when you know that about your physicians, know their likes and dislikes, and then sell towards their drivers, as opposed to just coming in and blurting out company features and benefits, which is not the way to do it. You got to learn their drivers and then sell to them. And that's what I showed them during that interview process. And that's how I got the job. So again, guys, you all can do the same thing that I did. I didn't have any special treatment, didn't have family members, didn't have sales experience, got it. Doesn't mean you have to have sales experience to break in either, but you have to put in work and you have to have the sacrifice to be able to do this. And now fast forward, again, 24 years in the industry, went from rep, manager, director, owner, had multiple businesses, and now been happily as the founder and owner of RepPath, where this has grown, exponentially over just in the past few years. But it's taking those same things that I learned with changing my mindset. I was never a coach. I never did recruiting. I never did consulting. No one prepared me for that. It's just the knowledge and information that you gain, but you constantly are working at it. You're constantly getting better. So it's the same thing that I learned as a sales rep and improved throughout my career that will help you, with future roles, would help you with future advancement. If you do decide to start your own company, these are all skills that are transferable to help you to be successful. So I know it's a long story, but I always wanted to share that to show you that you can do it too. I don't care who you are out there. You can do what I did and be even way more successful than I've been in my career. I'm no one special. So follow some of the tips that I'm talking about here, but change your mindset, put the hard work in, and don't put limitations on where you want to be, and you can break in. So for now, we're going to pause because we're at the halfway point, and I want to take a break just to get questions from the crowd. So James, if we have anything from the crowd, let me know.
Yeah, we have a couple from the crowd.
Awesome.
We got, how many hours a week were you putting in before you got your foot in the door?
How many hours a week? I mean, I didn't exactly measure the time, but I would say if you're schedule all the time. Let me say this. It's easier to say, start with an hour a day. You can learn a lot in an hour a day, but don't focus so much about the time. Focus so much about the end goal of getting information. So for instance, I didn't focus so much that I'm going to put in 5 hours a week to try to get the job at ABC company. I said, I'm going to keep contacting people until I speak to at least 3 reps to learn more about the hiring manager and the role. So focus that way. What's your goal? What are you trying to learn? And then don't focus so much on the hours. It's not that much time hour-wise, guys. A couple hours a day, it tops, and you will learn a lot. But it's just being persistent. It's not hard to create a little message, cut and paste, personalize it, and send it to 50, 100 reps, 100 people that work at the company. It doesn't matter. That's quick. It's, do you do the follow-up? What if they don't respond that first time? Me, I would keep sending it. I'm not sending it every day and being annoying, but have common sense. Send it a couple times until, if someone says, stop contacting me, I don't want to help you, then maybe you back off. But until they say that, keep going, guys, because again, you have to show them that you're not going to back down from a doctor just because they didn't get back to you. You're going to keep being persistent. So keep showing them that during the process, and just have your end goals in mind of how many people you want to speak with, what information you're going to get, what are your goals? And it doesn't matter about the time. Do that until you get the goal.
What was your approach to networking? Did you cold call? They asked if you DM, but you're a little older, so probably not.
DM wasn't around.
Do something unconventional.
So the first thing I did, so if any of you couldn't hear that, it was, what did you do to network? And DMing was definitely not around back then. You had to knock on doors. So first thing I did, going back to college, but some of you, even if you're not in college, you're out of college, you didn't go to school, start with physicians and people in the industry. Because even though physicians aren't sales reps, you get to see a day in the life. You get to pick their brain. They definitely could tell you what it's like with their interactions with reps. And even if it's as simple as, what do reps do that piss you off, or what do reps do that you really like, and finding that information out first, because you'll hear a lot of the same opinions from these doctors, which it's great advice to get. And if you can, ask to intern. Sometimes it's, it could be even spending a couple days and maybe bringing lunch in for the office, and the doctors will say that's fine. You might not be able to get into every area because of HIPAA laws and all that, but at least you could see a day-to-day what a doctor's doing. If you can ride along with a rep. Now, these times have changed from being able to walk in and out of hospitals, but you never know. The rep might say, no problem. Again, offer to buy them lunch, coffee, whatever. These guys have been in your shoes before, so don't assume that everyone's going to be nasty to you and doesn't want to help you. But until you ask, you don't know. So don't be afraid to go up to people and just start talking to them. Whenever you know someone that's in the industry, have a conversation. Now, when it comes to LinkedIn, which is an amazing resource, you don't want to just reach out to reps all day long, because you could do that until you're 500 years old. Start with the opening, where there's an actual opening that wants an entry-level rep, that you meet the requirements. And then when you send your resume and list the reason specifically on how you meet each requirement, then start talking to reps and reaching out to them that are in that division for that specific company. Because the closer they are to that opening, the more likely they are to help you out. So I'm not a fan of just reaching out to anyone and everyone on LinkedIn, because again, it'll take you way too long. But once you know there's an opening and then you target that company, I'd rather see you be laser focused on those couple of openings that are available than just sending your resume out to hundreds of open jobs out there. So definitely do whatever it takes. Knock on doors. If you're in the car today and you're going to get home at 5:00, stop at a couple offices. Just stop on the way home. Say, hey, listen, I'm looking to break in. Do you have any information? Can I speak to the doctor? Are there any reps that I can call? They have their contact. They have their cards everywhere there. Just be ballsy, guys. Just, what's the worst that happens? They say, no, I can't help you. So you're in the same place you were. So, and you're going to get that, but you're going to get those one or two that say, actually, you know what? Yeah, so-and-so is actually leaving right now, where a rep will be leaving, or the doctor could be behind the counter and say, how can I help? And when they see you and meet you face to face, this is where your salesman skills come out. If you're really good, this is a good chance to see, because this is real. If you can't handle that, if you're like, nah, I don't want to bother them, I don't feel comfortable going in there and just asking them for an internship, then you don't belong in this industry. You should not care You know, you don't want to be arrogant and annoying, but you got to have that thick skin. Be like, whatever. They don't want to work with you. No problem. Thank you for your time. On to the next office. You keep doing it. I'm telling you, that will get you further because it's going to teach you the rejection, or even worse, the no access, and see how creative you get to that decision maker to get some info or advice or an internship, whatever it is you're looking for.
We have. Looking back, what would you never do again during the journey?
I definitely wasted too much time just trying to talk to random people. Now, and that's what I'm talking about, where if someone says there are no openings, or you're just aimlessly knocking on doors, you don't want to aimlessly. Again, you got to have that goal in mind. And this is when I already had a job in the industry. You want to focus on where the openings are. But I would have been I'm trying to think, like, real regrets. I think I probably spent too much time. Actually, I know what I did. I spent too much time at the beginning when I first started doing researching about the products and trying to memorize all the information about a product or a drug. And that's not that important, guys. Now, you have to know what you're selling. You have to know what they sell. You have to know what their competition is. You have to know what's, the value proposition of the company and why a doctor would use you over the other companies. But you don't have to memorize. I mean, some of these companies have hundreds of products. You don't want to sit there and memorize the dimensions, the sizes, all that bullshit. They're going to teach you that in training. So learn more about the actual role, the company culture, the team dynamic, but most importantly, about that manager. Because the manager is essentially your physician. This is your customer. So treat this as the whole process is a sales call, guys. Don't be fooled. From when you send your resume to when you get the job, it's the same exact mirror image or parallels what you do during a sales call. From when you get that doctor's information to when you call on the doctor, when you get face-to-face, which is the same as an interview, to when you get the job, which is the same as closing a deal, getting a purchase order, getting a commitment. It's all the same. So do that and learn more about that hiring manager, because the more you know about him, I'm telling you, that's where you're going to see you move further in these processes. And the same when you're working with your physicians and trying to sell them, the ones that you put no effort into learning their background and what they really want, I'm telling you, you're going to fail, because I did it myself. I told this story before, but again, when I worked at Boston Scientific, I was so excited. This young pain specialist wanted to see me that I called on him 3 times. And then finally, the third time, I asked him how many stims he does a month. I didn't ask him that in the first couple conversations. And he says, "Oh, I don't do stim. I was never trained on it." I felt like a complete idiot because I wasted 3 conversations that I simply asked, what your experience is. Have you ever been trained? Would you like to be trained? I mean, basics, and that was a major screw up, but it was a great learning experience because I learned that I have to find out about the customer's needs first and then sell to them. I can't come in there selling my features and benefits until I know that. And when you do that, you make it about yourself when you just come in shouting features and benefits. And that's red flag city. That's a disaster waiting to happen. When you make it about them, that's when you can sell towards their needs, and that's when the success comes.
Okay, we got from Almost Famous Kid. Thank you for sharing your work and history and background. Definitely consider being a motivational speaker.
Thank you.
We have you ever bombed an interview, and how did you bounce back and not let them find you?
Well, I bombed many interviews, and one of my first interviews in that cattle call, which was an embarrassing but good story. It was with Merck, and I forgot the drugs at the time. I didn't do any research because I didn't even know Merck was going to be there. I'm waiting online just to, one out of, 5 other jobs that day that I'm going to try to speak to a manager and give my resume. And one of the other candidates online was all nervous. Like, I hear they ask, what drugs do they sell? And whatever drug they mentioned to, I forget, they're like, oh, I know they sell this. So I'm not really listening and in the conversation, but I'm listening to what they're saying. I'm like, all right, I'll just make a mental note. I'll say Zithromax, whatever the hell it was. So I get in there and, the interview wasn't going bad. It wasn't going great. It was okay. The hiring manager goes, so what drugs do you know that we sell? And I name a drug, and she pauses and stares at me like, what the hell are you talking about? And she's like, Joe, that's Pfizer. And I named a drug from Pfizer. Didn't even name the right company drug, felt like a complete idiot. And she actually said, she goes, did you just take a shot and guess? I go, yep, I did. And we both laughed, and I was in my head, I'm like, well, I bombed this. And she laughed too. Obviously, I didn't get the job, but it was definitely a lesson in preparation that I wasn't prepared, and I learned. But I've had interviews that sometimes when you're not connecting, and a lot of you guys out there could probably feel this, what I'm talking about. When you don't connect with that hiring manager and they're making you nervous because some of them are arrogant, they think who they are. There's a lot of amazing managers out there, but there's also a lot of bad ones. And when you're not really connecting with them, sometimes you get nervous and the interview kind of goes south because deep down in your gut, you're like, I don't want to work for this person. I don't feel comfortable, and those bombings there, don't look at it like it's so negative, guys. Sometimes it's meant to be. So you don't want to you're not going to nail every interview, but if you're not learning from each interview and growing and taking something from there, because you always do, there's sometimes a question that you're like, I wasn't prepared for that, but you better be prepared the next time. So it's okay if you weren't prepared for a question because you never know what they're going to ask sometimes. But as long as you keep learning from your mistakes and getting better and constantly trying to improve, then all those failures are actually what's going to make you successful in the future.
How has your life changed now that you're in the industry, personally and professionally?
Well, a lot has changed just by getting older, and a lot of your goals and your focus changes depending on where you are in your life. But I've grown tremendously in the past, like I should in that many years. But I've gotten much more comfortable in where I'm at. But I focused more when I was younger about doing things because it's the big name company, the cool sounding product. It was more like where the hype was about what you should be doing. And I wasn't as happy and as like now I'm like obsessed with what I do for a living. I love it. I literally work 7 days a week. And I know people that Courtney's saying, you never work when you love something, you never work a day in your life. I always thought that was stupid. I always thought that was ridiculous until I got there, where once you get to that point, and it doesn't mean your own business, it could be just working for a great company, selling something you love. And I definitely loved a lot of the products I sold. There were some that I wasn't that thrilled about, but still sold them well. So the biggest change for me is being really happy in what I'm doing and loving what I'm doing, because that's the key, guys. Don't do this. And medical sales in general, it's a great career. Anyone that wants to get into it, I'm more than happy to help you guys break in and be successful. And I loved it. I had a great career, but it's not for everyone. So don't do things and make yourself miserable. And it could be a great paying job. If you hate it and your manager sucks and the product, you're not really excited about the product to sell it every day, you're not going to be happy. So don't torture yourself with all that other stuff. Do what makes you happy. And that's what I learned over the years. That's more important. So that's been the biggest change.
What do you wish people knew about this process before jumping into it?
Knowing how hard it is for access. So all the time I get, Joe, I have thick skin. I could sell anything. It's you don't realize that, and I don't mean to insult anyone, but I'm just going to say you sound stupid. You sound like you didn't do your research. If you say you have thick skin and that's why you'd be good in this industry, then you have no idea what the hell you're talking about. And that, as a candidate coming in to interview with me, is a red flag. Now, if someone says to me, "Yeah, you can have thick skin, you take rejection, but all the more you understand that the access is there's almost no access. It's very limited, especially in the hospital space. Doctors in the office space, they used to let you walk in, you put your samples in the back, the doctor would walk out, give you 30 seconds, a minute, sign your script pad, say, what do you got that's new for me? Have a little conversation with you. And out of 10 offices a day, you'd see 6 or 7 doctors. Now, if you see 2 in a day, that's a good day. In the hospital space, you used to be able to walk with scrubs in and out of hospitals. Doctors coming out of operating rooms, you would talk to them. In the lounge, you'd be able to speak to them. Now they have vendor credentialing, where if you're not credentialed with one of the vendor credentialing services, you can't even get in the hospital. And then once you are credentialed, now you can't just walk around. You have to have an appointment that has been put in by the doctor or one of his staff members to allow you to even walk in there. So there's so much more red tape. So to be prepared for that, understand it's not just about thick skin. It's about understanding how the access is changed, and you have to change with the times and get creative to get your messaging to your customer. So if you really understand that, and that's where your conversation should be whenever you're speaking to a rep, whenever you're speaking to a doctor, how do they handle this? What do you do when you can't see a doctor? How do you become successful and get your messaging across? And again, these are some of the skills that I teach, in the RepPath Academy, where we go through this, that really prepares you for this skill, because this is a very important skill, if not the most important, to be successful in this business. It's getting your messaging across with no or limited access.
We have, what's the hardest thing that you had to unlearn or let go of to succeed in the industry?
Being stubborn, sticking to, you did things that used to work and now they don't, and to change your old habits. I mean, that's hard in pretty much in anything you do, but you have to get by that. Things change, time changes. Throughout my career, social media wasn't always around. It came around in the last 10 to 15 years, but when I first started, it was non-existent. You were leaving actual notes for doctors to invite them to dinners. You would go around with printed invites and drop them off. I mean, obviously this day and age, that's crazy. Some reps still leave handwritten notes, which some doctors find like, oh, that's original. That's old school. So you might get a response here and there, but bottom line, you can't just leave handwritten notes all day. You got to get with the times. Marketing has changed. Everything has changed. You got to, adjust to whatever new platforms and social media are. You have to, that's the only way to really evolve and get your messaging across the doctors. So I struggled with that for a while. I was old school. A lot of times I wouldn't call an office. I would always drive there. And I'm realizing that's just, if I'm booking an appointment, why am I really driving an hour to go sit in front with a receptionist for 2 minutes just to say, hey, Joe, yeah, I could put you in for next Thursday, instead of calling. So I learned to get more efficient, but I wasn't for a while. That was something that I screwed up. And I look back at it, I'm like, wow, I wasted a lot of time, driving time when I didn't need to. So it's just, my message is adjust with the times. Don't be stubborn and thick-headed like I was, and say, no, this worked in the past, so I'm going to keep doing it.
Okay. We have, Joe, what did your days actually look like when you were hustling to break in? Walk us through a typical grind.
Yeah. So every day, again, I start with going on at the time, whether it was LinkedIn, whether it was working with the recruiters that I had, whatever information you have, start with finding the openings that are that you're qualified for. So going on the computer in the morning, seeing what openings are in your area. So be select. I mean, less is more, guys. Don't focus and send your resume out to 100 companies. It's not going to work. Okay. I get 300 to 500 resumes for each opening that I get on average. Sometimes it's even more than that. So don't think just sending your resume is going to do it. So when you wake up, you're focusing on those specific openings. I would say between 5 and 10, but you're going full force, and putting your efforts into those 5 to 10 openings. So you're sending your resume, but you're going on LinkedIn and you're contacting the reps, managers, and directors, anyone at that company that works with that hiring manager, to find out as much as you can about that. It doesn't have to take much time. I don't need to walk you from 8 to 5 every day. That's not realistic, guys. Anyone that says they're doing it wrong, because the conversations, the outreach, it doesn't take much time. But I can give you metrics. I would suggest you reach out to at least 20 to 25 individuals that are connected to those openings every day. Reach out to them. Your goal, especially when an interview is booked, you have to speak to at least 3 people at that company. Non-negotiable. When they don't respond, I don't want to hear, well, Joe, I sent my message and no one got back to me. Bullshit. Send another one. Say, hey, I sent you a message. Did you get it? Be upfront. You have to treat it, again, getting back to the mindset, that you are an asset. You are going to be a great rep for this company. They don't know that, guys. So unless, it's like anything else. If you're really good at something and you can solve a problem, like remember being in school and you're raising your hand when you knew the answer, because you could solve the problem. So you're going to jump up and down in the chair until the teacher calls on you. Treat it the same way. Have that attitude, like, oh no, you didn't hear me the first time. I contacted you because I'm a great candidate, and I want to tell you why. I want to be able to I know what the problem is, your company. I'm here to solve it. So have that persistence, and make that the goal, that you're going to reach out to the 20, 25 every day, but it's going to result in at least three. It could be more before you get in the interview. Because when you have that attitude that they need you, and that they need you, and you're here to be the solution, that's when you're going to see you get the job opportunities.
What kept you going after facing a lot of rejection during the interview process?
My motivation was I'm not giving up. It doesn't matter. I'm getting in. So I don't care if I get rejected for 3 years, 10 years. It didn't matter. I was going to break in. This is what I want to do. So I didn't put a timeline on it, but I didn't, when you get to the final round and they pick someone that's internal or whatever reason, yes, of course you come home, you curse, you want to break things, you get frustrated. It sucks, but don't, again, it's almost like when, you lose a game in sports. Did you quit because you lost? No, you get up the next day, do it over again. So that was the mentality I had. I'm not stopping until I get my goal. So that's what always kept me going. So know that you're going to get rejected. The advice is to always take something and learn something and grow. And those failures, don't look at them as failures. They're just steps towards your success. I mean, you heard Michael Jordan, took however many, thousands of game-winning shots that he missed. Wayne Gretzky missed however many shots on goal. All those old school sports stories, but they're true. They failed a lot, but they're still considered the greatest. They're goats in their fields, in both their sports. So have that same mentality, guys. Just, you're gonna get it. It doesn't matter. That's all part of the process, the failures, but you're not going to stop.
Joe, did your friends and family understand what you were doing, or did you feel like you were on your own?
I felt like I had their support, but it wasn't, to be real, my parents every day, they weren't, dressed in cheerleading outfits saying, Joe, we're so excited. Where are you in the process? Like we're all rooting behind you. I mean, they knew that I really wanted this, but it was just that they were supportive, that they knew that whatever I wanted to do, whether it was medical sales, I mean, I could have been a plumber, an electrician, a doctor. It didn't matter. They were behind me in whatever I wanted to do. So they were always supportive, knowing how passionate I was to get into this field.
We've tell.
That's okay.
How many interviews did you take before you got your first yes?
I think total, it was probably about 15 to 20 in that range. I mean, there were some interviews, there were some screening interviews with recruiters that didn't move me forward. I went to a couple final rounds. It was definitely around that. But, again, that was just me. But that was also after I got a year and a half of B2B sales experience. Before that, I got zero. I got no response, nothing. I also was doing a lot of things wrong. My resume was a disaster. My approach, reaching out to people, was a disaster. Everything I was doing wrong. I was just reaching out to people without openings. I mean, a lot of things that I've learned now, the correct approach with networking, with optimizing your resume, with creating a good story. And that's very important. I didn't get my story down until later on. And my story at first sucked because it didn't show the passion. It didn't really show my why. It didn't connect what they do at each of an individual company. And that you have to master. And then lastly is your interview prep. I wasn't really prepared. I mean, I'm naming drugs that companies don't even sell. I mean, what's worse than that? So, you can definitely shorten that period, that timeline, and not be in as many interviews. And some of you could just, you could be moving far, and sometimes the stars just don't align. So don't say, if I don't get it after 10 interviews or 20, don't have that in mind. Say you're going to constantly improve until you get the job.
We got one last one. Was there a moment where you finally felt like you were going to make it? This was the best career path for you?
Yeah, absolutely. And that was when I was observing at St. James. I mean, when I saw a number of those cases time after time, how much impact, how much responsibility those reps had, that's when I was sold. When I saw them listening to physicians listening to them, and them actually taking control of the case and being such a major part of it, I mean, that's when I was all in. So that was my moment.
That's all I got.
Awesome. Well, guys, again, we're coming up on time for today. I want to thank everyone for joining. As always, for all our lobby members, please make sure that, to get additional discounts, and this is open to anyone looking for coaching, please DM me, whether you're looking to get help with your resume, help advancing in your career, whether it's networking, telling your story, interview prep, whatever it is, we help you not only break in, but advance in your career here at RepPath. So love for you to be a part of the RepPath Academy. To do so, just message me. You could shoot me an email, send me a DM. My email is joe@reppath.com. And for all you lobby members, to get additional discounts, please send in, when you message me, the promo code Licata, Licata, to get additional discounts. Continue to again, subscribe to my channel, Unfiltered Medical Sales Coaching. And then every Monday and Wednesday, guys, 3 p.m. Mondays are going to be more advanced topics. Wednesdays are going to be more entry level, but they're still going to be able to provide value no matter how many years you've been in the industry. Because when we talk about resumes and interviewing and all those tips, it's something that anyone can benefit from. So I want to thank you guys again. Thank you for joining, and I'll talk to you soon next week.